You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Now, here's John and today's guest.
Welcome to Recovery TV, and I'm your host, John Tassoni. The gentleman I'm going to interview today, I don't think needs an introduction, but I will introduce Mr. Tom Cordier. He's the Acting Deputy Assistant Secretary of SAMHSA. So welcome, Tom. Welcome back.
Thanks so much, John. It's
Welcome
great to
back.
be here.
And
Thanks for having me on the show today.
It's great to see you again, as always.
It's good to be here.
So, Tom, SAMHSA is going through a little bit of a reorg. I'll use that word, reorg.
Well, you know, every time there's a change in administration, the new administration that comes in takes a look at, you know, what is going on in the agency, and they want to put their mark on the agency.
Stamp of approval.
Well, exactly. And, you know, that's necessary for a couple of reasons. One, you know, the country has elected new leaders, so there's a direction that the country wants to go in. And number two, every 5 years we redo our strategic plan anyway.
Mm-hmm.
Congress mandates it. So we go through that process that Congress has outlined, and we make sure that our mission and our vision are meeting the needs of Americans, and we look at our priorities too to make sure that we don't need to shift somewhere there. Right.
So now that the country's going in the wrong direction with substance use and mental health, what are the priorities of SAMHSA now?
Well, let's talk a little bit about us as an agency first.
Right. Okay.
We are, at SAMHSA, we are the operational division within the United States Department of Health and Human Services that's responsible for advancing the behavioral health of the nation. Mm-hmm. So what does that mean? It means that anything that's to do with substance use disorder, mental illness, it really falls under our purview. Mm-hmm. And so our mission is to lead the public health and the service delivery efforts that promote mental health, prevent substance misuse, and provide treatments and support that foster recovery while providing equitable access and better outcomes for Americans. Mm-hmm. It's our vision, we envision, I should say, that people affected by or at risk for mental health or substance use conditions receive the care they need, achieve well-being, and are able to thrive in the community of their choosing. We think that's really, really important. And so I think that's kind of how we level set. That's our base where we start from. In our new strategic plan that I was sharing with you just before we started, we've kept the prevention and promotion and treatment continuum at the core of our strategic plan. And we've started to prioritize things like equity, trauma-informed approaches, recovery, and a commitment to data and evidence. And our priorities focus on 5 key areas. One is preventing overdose, which is what you were referring to a second ago, and hopefully we can get into that a little bit more and talk about what that means. Enhancing access to suicide prevention and crisis care, promoting resilience and emotional health for children, youth, and families, integrating behavioral health and physical health, and then one I know that's near and dear to your heart and the folks, all my friends at SUMLAC, is strengthening the behavioral health workforce. You know, how do we build capacity in that workforce so that we can be prepared to address the increased behavioral health conditions that we're seeing across the country.
And you know, and I do have to give kudos to Congress about doing the CCBHC stuff, getting that off the ground and funding it appropriately, because it not only helps access to care, but it also helps the providers who have been suffering for years for the rates and the increases. And you know, we here in Rhode Island, I'm sure you're aware that, you know, we've been decimated with the workforce, and the hospitals taking all the folks out of the community-based healthcare system and bringing them into the hospital because they were shorthanded. And the capabilities that the hospitals have, we don't have as far as funding. So that, you know, that's a big thing. So I do have to give kudos to the administration for passing something like that and working with that. I got to give
CCBHCs, for your viewers who might not know what they are certified community behavioral health clinics. And this is where it's a model that was developed several years back that really provides integrated care, the integrated care I was talking about earlier, for people with mental illness or substance use. Congress has invested over $1 billion in these vehicles over the past 3 years. Amazing investment in these community resources, and amazing work that's happening. Look at the work that's happening. One of your former guests, Jamie Lahane, I know talked a little bit about the work he's doing down in Newport County with them. But throughout Rhode Island, we're seeing this increased need, and so CCBHCs can be a real important vehicle to provide evidence-based wraparound services, holistic care for people with substance use disorders and mental health conditions.
I think that's the biggest complaint is access to care.
Right.
You have to wait so many months to get an appointment. We don't have enough beds for residential care. We don't have enough hours in the day to distribute medicine because we don't have nurses. So the whole system, it's almost like it's a perfect storm. And I would venture to say, you tell me if I'm wrong, it's happening around the country, not only just in Rhode Island, across the country.
We are facing unprecedented mental health and a substance use crisis among people of all ages and backgrounds in every single community in this country. It's just bigger than it's ever been before. And although the rates of depression and anxiety were rising before the pandemic, the grief, the trauma, the physical and the social isolation that many people experienced as a result of the pandemic, that's really contributing to this increased need for services that you just mentioned.
Yeah.
It's really important.
The amount of children that this pandemic has affected, I'm hearing from school base all the time about antics that are happening in school and behaviors in school. If we don't act on this now, we're in for a long haul.
No, it's true.
When me and you are in our late 70s or early 80s, we're going to see a tremendous amount of kids not acting the way they're supposed to be acting.
Well, and I want to be careful about how we talk about this because I think it's important that it's not, not attach a morality to it, good or bad, right? I think it's better to think about it in terms of resiliency. We have a project at SAMHSA that we fund called Project Aware. Advancing wellness and resiliency is what it's all about in schools. When we were going to school, I think we were I don't know, we were trained a little differently, and certainly the world was different then. But kids today they're really having a tough time addressing their
coping.
Their coping mechanisms they just don't have the same coping mechanisms. And I know they're dealing with a lot more. We didn't have social media like they have. We didn't have the kind of bullying they have today. We didn't have anxiety and depression in the same way that they have today. So I think really focusing on what you talked about in schools is really, really critical, and we're spending a lot of time thinking about that at SAMHSA.
We're going to take a quick break. We'll be right back. You've been watching Recovery TV, and I'm your host, John Tassoni, here with my good buddy, Tom Cordair from SAMHSA. We'll be right back after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Mr. Tom Cordair is in the house, Acting Deputy Assistant at SAMHSA. So welcome, Tom, and thank you for joining us today. Thank you for coming all the way in from D.C. to join me today.
My pleasure.
So, Tom, I don't have to tell you, Rhode Island is breaking records year after year after year with overdoses. Where do you see this going?
Well, you know that the overdose crisis has continued to evolve over the past few decades. And right now we're in, I think, what some would describe as the fourth wave of it, with illicitly manufactured fentanyl, just a really poisonous substance that is in our drug supply. And so all the work that we've done, I was co-chair of the task force here in Rhode Island under Governor Raimondo when she started to make some progress in the crisis, and then the drug supply changed really rapidly. And so we started to see more and more overdose deaths. It's heartbreaking. We know behind each of those deaths is a father, is a mother, a brother, a sister, a friend, somebody, a partner, somebody who was loved. And so it breaks our heart every time we see that happen. And so we have done all that we can to increase access to evidence-based prevention, harm reduction, treatment, and recovery support services. HHS, our secretary, Javier Becerra, released overdose prevention strategy back in 2021 so that we could address some of the things that had been changing about the epidemic. But where do we go from here? We just keep working as hard as we can. We can't let up now. But it has to be both. We did this in Rhode Island. We made sure that it was a public safety and public health response, that it wasn't just one or the other,
right,
that it was both, because we're not going to be able to treat our way out of this. We're not going to be able to prevent our way out of it. We're not going to be able to recover our way out of it. We really have to work together on the supply side and on the demand side to try to get things under control.
And now we get another one that's just popping in now.
Xylazine.
This animal stuff that they're
yeah,
putting in there.
Yeah, no, and we're going to see more and more synthetic versions. These are cheaply produced synthetics that are coming from overseas, making their way through porous parts of our borders, whether it's our ports or our mail system, our borders. And so we really are working closely with law enforcement to try to stop the flow of those, but it's really complicated. It would disrupt all of our infrastructure if we were just to shut down completely, so we can't do that.
Right.
So what we have to do is continue to try to get smarter about finding these illegal substances that are coming in and poisoning our people.
Yeah, you know, it's one step forward, then 2 steps back.
It feels that way.
Right? I mean, you try to get the ball down the field, and the next thing you know, there's a fumble.
Yeah, it's frustrating.
And then you have to reconfigure.
But there's great work being done.
Oh, no doubt.
Great work being done here in Rhode Island. Governor McKee has stepped up and appointed a community liaison to the task force, Tommy Joyce, who I know you know.
Yep.
They have folks over at BHDDH, Dr. Charest. We have some new folks at the Department of Health who are digging in on this. We have Kathy Schultz, Lauren Nocera, who are dear friends and people with lived experience who are informing the work that's happening with the opioid settlement funds and the task force itself. So I remain hopeful. I'm trying to remain as hopeful as I possibly can that we're going to be able to beat this thing.
You know, I think all the people that are in our circle remain hopeful.
Please,
please
do.
And, you know, and I say this all the time. I hope someday they knock on the door and say, John, thank you very much for your service. We don't need your show anymore.
That would be nice.
That would be fabulous for me. I mean, the thing of why I do this show is for informational purposes, so people get it.
Right.
They know where they need to go for help. They know where they need to go for information, and we have a ton of it.
No, and I appreciate you getting that out there. I appeared on your radio show prior to this to try to talk about not only the problem, because I think that's oftentimes where we get stuck, is we get stuck in the problem.
Right.
But you've been really focused on the solution, for which for me is recovery. You know, I'm a person in long-term recovery myself, which means I haven't used alcohol or drugs since May 15th of 2003. So I try to use my story and my lived experience to try to advance changes in public policy and try to help more people find what I found. I think that's really, really important. And I think, you know, that's where the hope comes. And if we can look at recovery as our end goal for people with substance use disorders, or people with mental illness as well, or people with something that co-occurs, with people have these two things occurring at the same time, I think we'll be a better country for it. So we're trying at SAMHSA to really, we set up an Office of Recovery for the first time ever to try to staff it with people with lived experience. They review all of our documents, all of our notice of funding opportunities, all of our publications that are going out. They're looking with a recovery eye. Is this recovery oriented? Are we really focused on the solution here and not just the problem? And are we thinking about recovery at the beginning, right? When we start a process, not just at the end as an afterthought.
Right. But there's so many people, Tom, and you know this. There's so many people who may be watching this show and say, you know, I'm just going to keep using because there's no hope. But I have people on, like yourself, Jonathan Goya, and a number of other folks.
Right.
I got Chris Herron coming on in a few weeks.
So you had Steve Gumbley.
Steve Gumbley. But my point is that I'm trying to relay a message to folks, okay, you're having a problem with substances right now, get help, get treatment, and then you can get a job like Tom Cordier or Steve Gumbly or Jonathan Goya or the rest of the folks.
Yeah.
You know?
There's a lot of hope. Or, you know, and some people don't want jobs like we have.
Right.
But they may want to go back to work in the construction industry where they worked before.
Right.
They may want to go back to work in the hospitality industry or in tech. We have a lot of people who work in tech.
Right.
So, yeah, the sky's the limit if you find and sustain your recovery for the long term.
Right. So there's another project on the table, 988. Let's talk a little bit about that,
Absolutely.
and then we're going to take a break, and then we're going to come back.
Perfect. So 988 is an easy, obviously, 3-digit number, easy to remember, easy to call when somebody's in crisis. And it really, what it did was replace the National Suicide Lifeline. Last July, we launched it. And it's been tremendously successful. We've increased the number of people who are calling in, and it's not just a place where somebody can call, because that is an important part of crisis, right? Having a place to call, but you need someone who can respond, and you need a place to go, oftentimes, for people. Now, people don't need all of those things. Some people just need the call. Some people need the response. Some people need the place to go. But how do you do that? How do you triage that? How do you build the capacity in the system so that when somebody calls, you have the ability to help them and get them the help that they need?
Right.
So if there's anyone out there who's experiencing a mental illness, a mental health crisis, substance use crisis, call 988. The trained counselors can answer the call, can guide you to resources, maybe can even just help you right on the phone line, talk about what's going on in your life and how you can get through it.
We'll talk a little bit more about that when we come back, because I
great.
can take a break to pay the bills.
That's good.
You're watching Recovery TV, and I'm your host, Sean Tassoni. Here with my good buddy, Tom Cordier from SAMHSA. We'll be right back after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, Sean Tassoni. Mr. Tom Cordier is in the house, and he's the acting Deputy Assistant Secretary for SAMHSA. Tom, thank you for joining us today, and thank you for doing the work that you do. It's very much needed.
Been a great show.
So we got mental health issues going on now, so let's talk a little bit about SAMHSA's role.
Sure. So we are the agency that is charged with advancing the behavioral health of the nation, but we don't do it alone. Our partners in the administration, President Biden, members of Congress, have really stepped up to the plate. You know, if you want to ask me about what my priorities are,
what are your priorities, Tom?
Not just my priorities. Well, look at my budget, right? And look at our budget.
Yeah.
And look at the president's budget. They've invested, the omnibus that just passed, invested $1 billion more in mental health services, which is amazing. We had the American Rescue Plan that passed prior to that. We had COVID relief dollars. This has traditionally been very much an underfunded part of the budget over the years, but we've appreciated so much having the additional resources. The Bipartisan Safer Communities Act that just passed is going to have a direct positive impact on strengthening the behavioral health of individuals with mental illness or substance use disorders. So we are so fortunate to be able to have the support from Congress and from the President. We had $800 million in funding for SAMHSA for behavioral health grants, $250 million for the Community Mental Health Services Block Grant, which a lot of the local providers really count on, $240 million for the Project Aware that I talked about before, advancing wellness and resiliency in education, $120 million for mental health awareness training. It's just been amazing.
It's a dream come true.
Tom
Cordier from SAMHSA has been my guest today. Thank you for coming on today.
Thanks.
Really appreciate it.
Thanks, John.
Zinnia Health will be my guest next week. Thank you for joining us. You've been watching Recovery TV, and I'm your host, Sean Tassoni. See you next week.